This topic is standards for medication administration. The rights of medication administration. You can remember some of these by remembering time card. The right time, indication, medication, client, amount or dose, route, and documentation. They all help you deliver medications safely. Let's look at what each one of these means. The right time. The right time and frequency. You want to administer correct medication at the appropriate time and frequency. Examples of administration schedules include TID, which means 3 times per day, and Q8H, every 8 hours. A good thing to remember that TID and Q8H both mean medication will be given 3 times in 24 hours. STAT means immediately, PC means after meals, and then PRN is as needed. You'll see that a lot with pain medications. Guidelines for medication administration schedules. There are facility guidelines. Some medications must be administered at a specific time. For example, administer 1 hour before meals, or within a certain time of incision in the operating room. Now, we want to make sure that the client can do all of this at home too. So we'll evaluate the client's ability to self-administer medications prior to discharge. We can assist the client to create a daily medication schedule. Right indication. We want to make sure that the medication is appropriate for the client's condition and the clinical findings, like blood pressure or pain levels. And we want to verify the client's diagnosis. The right medication. Is this the medication that was ordered? Is the client allergic to the medication? And you want to make sure that you are only administering medications that you yourself have prepared. We'll do 3 checks to make sure we have the right med. When removing the medication from the medication dispensing system, when removing it from the packaging, and then at the bedside before administering it to the client. The right client. We want to verify the client's identity. This is very, very important. We want to use 2 or more client identifiers on the MAR, the client's name, medical record number, and the client birth date. A lot of times you can walk in the room, let them know that you're caring for the client, and ask them their name and birth date right away. And we can verify that on their ID bracelet and in the MAR. And then you can look at that medical record number at the same time. We never want to use the client's room number as an identifier. You might have clients that roam and end up in the wrong room. And we can utilize the barcode medication administration scanner if it's available. You scan the barcode on the client's ID bracelet prior to scanning the medication. You, of course, want to avoid all distractions when verifying the client. If you get interrupted by a phone call or a pager or a call light, start at the beginning and re-verify all the steps. The right amount or dose. Is the dose appropriate for this client? We want to use standard measurement devices to prepare medications, like measuring cups with lines on it, droppers with measurement markings, and, as pictured, specific syringes. And we want to remind the clients to use the same type of measuring devices at home, rather than using household teaspoons or tablespoons, to make sure that the dose and amount is accurate. You also want to know the normal dose ranges. Does this seem like a normal dose of this medication? Is it normally 40 milligrams and today it says 400 milligrams? Maybe a mistake was made. And you can double check dosage calculations and infusion rates. Some facilities require another nurse to sign off on that, sometimes for insulin dosing or even heparin. Splitting tablets. We always want to use a tablet splitter and only split scored tablets. We also want to take into consideration the client's ability to do this at home. Do we need to find them a device to help them? Crushing tablets. After you've crushed a medication, you can mix it with a small amount of food or liquid to make it easier for the client to take. Not all medications can be crushed, though. Enteric-coated tablets and time-released medications are not to be crushed. Enteric-coated tablets have a coating on them that allow it to dissolve in the intestines, where it's absorbed, and not inside the stomach. The coating protects the drug from the effects of acid and pepsid in the stomach, and it protects the stomach from the medication that could cause harm to the stomach. Time-release medications are meant to last a longer time. If crushed, the client will receive a large amount within the first couple of hours, and then the effect will wear off. Crushing these causes an uneven and less predictable effect. And we want to remember to clean the devices prior to using it to crush a medication, and then make sure all of the medication that you crushed has been removed for proper administration. The right route. The method of medication administration. The route must be included in the medication order. And you want to ask yourself, is the route appropriate for the client and the medication? Is this something that is PO by mouth and the client can't swallow effectively? We'll need to reach out to that healthcare provider. The right documentation. We want to make sure that we document in the MAR the client's full name, medication's full name, time of administration, dosage, route, and the nurse's name and initials. Also document the client response, like an adverse reaction or an expected reaction. And then pertinent measurement parameters. That might be a blood pressure prior to an antihypertensive medication or a pain rating before a pain medication. And then never document prior to administering medication. I was always taught a lot can happen between getting the medicine out of the medication administration machine and giving it to the actual client. So you want to make sure you administer it and then document it. The right to refuse. Competent clients have the right to refuse medications. This goes along with client autonomy. If that happens, we will provide information on potential consequences of that medication refusal. Of course, we want to make sure we document everything that we told the client and their response. And then we'll need to notify the healthcare provider. Now let's talk about a couple additional rights. The right assessment. This could be specific parameters for administration, like an apical pulse or a blood pressure. And the parameter may be, do not administer medications if the pulse is less than 60 beats per minute. Then you'd hold that medication. Right evaluation. That could be pain relief or a decrease in heart rate, and also adverse reactions, a rash or difficulty breathing or facial swelling. We want to make sure we document those findings in the MAR. And right client education. We want to provide clients education in terms that they can understand. Why the medication has been ordered. What is this medication for? What disease process? What to expect after taking the medication, what is expected, and what is an adverse reaction. And then precautions or warnings related to the medication. Do they have to avoid certain foods or drinks? Do they need to have blood tests with this medication? Or are there manifestations of toxicity the client needs to be aware of? Safety is always our #1 priority, especially when administering medications.